Neurology Quiz number 17. What is catamenial epilepsy? It refers to cyclic exacerbation of seizures at certain points in the menstrual cycle. It can affect 30% of women with epilepsy. In the menstrual cycle, estrogens are proconvulsant, while progesterone is anticonvulsant. 3 patterns exist. C1, perimenstrual, from day -3 to 3, C2 periovulatory from day 10 to -13, and C3 the entire luteal phase for anovulatory cycles, which is day 10 of one cycle to day 3 of the next. By definition, there is a twofold or greater increase in average daily seizure frequency during the affected part of the cycle as compared to the remainder of the cycle. In normal cycles, fall in serum progesterone levels just before menstruation and the surge of serum estrogen levels at ovulation can lead to increased seizure frequency. In anovulatory cycles, estrogen levels stay elevated throughout the luteal phase with relative estrogen excess during the entire second or luteal phase of the cycle, resulting in seizure exacerbation. Treatment is hormonal and non-hormonal. For the C1 type, oral progesterone 200 mg TID is given during the days of seizure exacerbation. Non-hormonal treatments include acetazolamide 250 to 500 mg BID or clobazam 10 mg BID given during the period of increased seizure frequency. Another approach is to consider a small increase in baseline AEDs during the period of seizure exacerbation. What treatments are available for spinal muscular atrophy or SMA? Spinal muscular atrophy is caused by mutation in the SMN or survival motor neuron 1 gene on chromosome 5 with impaired production of SMN protein. Another gene on chromosome 5, SMN2, also produces SMN protein. However, much of this protein is normally non-functional due to skipping of exon 7 in the gene, but some protein is functional. Multiple copies of the SMN2 gene can be present in an individual, and the presence of 3 or more copies of the SMN2 gene is associated with milder disease. Nusinersen is an antisense oligonucleotide which corrects skipping at exon 7 in the SMN2 gene, leading to production of more functional SMN protein. It is given intrathecally every 4 months for life. Risdiplam, an oral agent with a similar mechanism, is given daily. Onasemnogene abiparvovec is a virus-mediated SMN1 gene replacement given intravenously as a single dose. Studies have shown significant improvement in motor function with these agents, and the response is most striking when administered in the first few months of life. What is herpes zoster ophthalmicus? Herpes zoster ophthalmicus occurs when varicella zoster virus reactivates in the ophthalmic distribution of the trigeminal nerve. It is most likely to occur with involvement of the nasociliary branch of the ophthalmic division. Such patients have a periorbital vesicular rash involving the tip of the nose, also known as Hutchinson's sign. It can lead to serious ocular complications such as keratitis, uveitis, iritis, scleritis, with acute or progressive outer retinal necrosis and retinal detachment. In addition, these patients may develop partial or complete 3rd, 4th, 6th cranial nerve palsies. These patients are at higher risk of developing stroke from VZV vasculitis in the following weeks or months. They are also at higher risk of developing myocardial infarction. Patients are treated with oral acyclovir 800 mg 5 times a day for 7 to 10 days. A short course of oral prednisone is recommended by some experts.